Thank you, Professor Beryl, for giving me an opportunity to present my thesis. My thesis name a pilot study on ways to increase people awareness of mental health and to prevent suicide in Bangladesh. As well, I have focused not only in Bangladesh, as well I have focused some perspectives from America. At the beginning, I would like to say something about the whole thesis, and I would like to go to abstract. The thesis basically explores the awareness of mental health and is a review of the literature with a focus on Bangladesh. Mental health cannot be measured easily compared to physical illness. Inability to think properly, lack of mental energy, and or emotion can make it difficult for some people to cope up with a modern lifestyle. According to WHO, 1 in 4 people will be affected by mental or neurological disorders in their lifetime. Around 450 million people currently are sufferers, as well as having mental disorder leading to disability, ill health worldwide. It has been seen by the WHO report that mental health is much more neglected in Bangladesh, vice versa like physical health. The aim of the thesis is to make a pilot study to raise awareness in mental health concentration area Bangladesh, and some feature has been perceived from America. To fulfill the objectives, to examine the mental health aspects in Bangladesh and America, literature review, to examine the real life case studies. I have also done some real life case studies which I will show at the end of the thesis. To identify the challenges on treatment in mental health in Bangladesh, to identify the information about the challenges in mental health. Chapter 1 basically concentrate on awareness of mental health and what is mental health. It is very important to know in depth about mental health. The signs and symptoms will help anyone to be aware of mental disease in themselves and in others. And early stages detection of mental health issues may allow a cure for mental problems, and some person can then resume to have a normal life. A mental illness is a disease that causes mild to severe disturbances in thought and or behavior, resulting in an inability to cope with life's ordinary demands and routines. There are more than 200 classified forms of mental illness. Some of the more common disorders are depression, bipolar disorder, dementia, schizophrenia, and anxiety disorder. Symptoms may include changes in mood, personality, personal habits, and or social withdrawal. The sign and symptom is very important for mental health. It has been seen that from a severe depression, a mental problem started. So let's focus on some sign and symptom. In adults, young adults and adolescents, confused thinking, prolonged depression like sadness or irritability, feelings of extreme high and lows, excessive fears or and anxieties, social withdrawal, dramatic changes in eating or sleeping habits, strong feelings of anger, strange thoughts, delusion, and so on. In older children and pre-adolescents, substance use, inability to cope up with problems and daily activities, changes in sleeping and or eating habit, excessive complaints of physical alignment, changing inability to manage responsibility at home and or at school, and so on. In younger children, changes in school performance, poor grade despite strong efforts, changes in sleeping and or eating habits, excessive worry or anxiety, hyperactivity, persistent nightmares, and so on. Prevention and awareness on mental, how we could prevent from mental health. Firstly, it is very important for families who have a loved one suffering from mental illness to accept the facts and situation. As has been seen from mental health in America report, actually mental health issues are seen in almost all the families in the USA, as they are in every country. Bangladesh in Asia and like everywhere has mental issues. Denying the warning signs, stressing what other individual will think in light of the fact, such as potential disgrace, can make the vulnerable loved family member even more sick. So it has been it is very important that family members should support a mental health patient in spite of their problems and diseases. If the family members support any patient or any mental health person, the person should get sooner well than before. So handling unusual behavior. Once again, I have mentioned the family member should be aware how to handle unusual behavior of the person. It is very important for the family members to understand the fact mental illness usually start with outward behavioral problems. The outward indication of a psychological sickness are frequently found. An individual might be incredibly peaceful or withdrawn. On the other hand, the person may begin crying uncontrollably, have incredible uneasiness, or have upheavals of outrage. Forming a support network means at whatever point conceivable, a person or patient will look for help from loved ones. In the event that the patient or person cannot discuss about the circumstances with companions or other relatives, it is especially important to locate a self-improvement or care group, and so on. Advisor required for the mental patient and person. Every advisor is needed. So I have mentioned something about it. I would like to read. Treatment can be advantageous for both the mental person with the psychological instability and their relatives. An emotional wellness expert can propose approaches to adapt and better comprehend the tourist one's environment. Then investing significant energy. Usually the individual with the psychological maladjustment will turn into the focal point of family life. At the point when the situation occurs, different individuals from the family may feel disgraded or angry. Some may think it's hard to sit after their very own advantages. In this type of scenarios, the guardian needs some time for themselves. On the off chance that planned time for each will assist with keeping things in context and may more tolerance and empathy for adapting or helping the adult one. Being physically and candidly sound encourages other people. Mental Health America 29 mention numerous families who have a friend or family member with a dysfunctional behavior share comparable encounters. Proper treatment. For the correct treatment, it is recommended by the physician to visit to a correct place. The first choice is a local health department, mental health organization, family physician, family services agencies, education consultants, or school counselors, family counselor, child guidance counselor, and or psychiatric hospitals. To avail the base services from the hospital, so if a person is sick or we need to, before to admit in a hospital, we should consider we should double check some points before admitting a patient to the hospital, like does the hospital facility treat patient only for the specific diagnosis? If the patient has other health or emotional problem, will he or she receive treatment for this problem also? So these are the points which is very important before we admit a patient in the hospital, which I mentioned over here. So staying in the hospital, also what are the facilities or services if the patient stays in the hospital, that's really need to be considered. So staying in the hospital also raises some question, like when the patient can't or another family member talk to the therapist or doctor. In our country, it's sometimes when a patient is admitted in the hospital, the doctor or the doctor or the hospital authorities sometimes they do not allow the they do not allow family members to meet the patient frequently, which is sometimes is very hard for a patient to cope up with the hospital environment. So these points should be clear before admitting the patient. When can family member visit? For how long? Will the patient be allowed to receive phone calls? Will the patient have a daily schedule of activities or treatment? If so, what activities will be the patient be involved in? Is therapy group or private, and is it part of the treatment plan? What clothes should the patient bring, and so on. And question about leaving the hospital. So after the treatment, if the patient leaves the hospital, there should be some questions that need to raise, like will someone advise the patient and family about adjustment concerns such as the need for further counseling or a medication schedule? What can expect when the patient is discharged? How will this medication help? Are they habit forming? What are the side effects? What is the dosage? How long will the patient have to take this medication? Then what follow-up treatment or support group option should the family and patient consider? Then chapter 2. Chapter 2, suicide rates are tied to mental health, suicide tendency globally. So suicide as well tied to mental health. It is linked together. World Health Organization characterizes well-being as a condition of complete physical, mental, and social prosperity, and not only the non-appearance of alignment of alignment and on a ailment. So social insurance as a compassionate movement, as a part of human rights assurance, and as a fundamental component of distribution lightening must incorporate psychological well-being in its action. Consistently, every year about 8 lakh individuals end their own life, and there are a lot more individuals who attempt suicide. Each suicide is a catastrophe that influences family networks and whole nation and has durable consequences for the individuals deserted. Suicide happens all through the life expectancy and was the subsequent driving reason for death among 15 years old internationally in 2016. Suicide is the third leading cause of death in 15 to 19 year olds. Suicide doesn't simply happen in high-income nations, yet is a worldwide phenomenon in all districts of the world. Truth to be told, over 79% of worldwide suicide happened in low and middle-income nations in 2016. So it has been seen from WHO report that suicide also happened much more in low and middle-income nations rather than high-income nations. Suicide is a genuine general medical issue, be that as it may. Suicides are preventable with auspicious, proof-based and frequently minimal effort intercessions for national reaction to be successful. If far-reaching multisectoral suicide counteractive actions technique is required for every suicide, there are many more people who attempt suicide every year. A prior suicide attempt is the single most important risk factor for suicide in the general population. Ingestion of pesticide, hanging, and firearms are among the most common methods of suicide globally, said by WHO 2019. It is evaluated that around 20% of worldwide suicides are based on pesticide self-harming, a large portion of which happen in country farming territories in low and middle income nations. Other normal techniques for suicide are hanging and guns. So who are at risk? Well, the connection among suicide and mental health issues is understood in high-income nations. Numerous suicide happens hastily and snapshots of an emergency with a breakdown in the capacity to manage life stresses. For example, monetary issues, relationships, separation, or constant acne and ailment. Also encouraging struggle, debacle, savagery, misuse, or misfortune and a feeling of disconnection are unequivocally connected with self-destructive conduct. Suicide rates are additionally high among defenseless gatherings who experience separation, for example, exile and vagrants, indigenous people groups, lesbian, gay, swinger, transgender, intersex people, and detained. So prevention and control, how we could prevent and control suicide. Suicide are preventable. Information on the most normally utilized suicide techniques are imperative to devise counteractive actions methodology which have been demonstrated to be compelling, for example, limitation of access of methods for suicide. There are various estimates that can be taken at populace, subpopulace, and individual levels to anticipate suicide and suicide endeavors. They are as follows. There are reducing access to the means of suicide, reporting by media in a responsible way, school-based intervention, introducing alcohol, policy to reduce the harmful use of alcohol, early identification, treatment and care of people with mental and substance use disorder, chronic pain and acute emotional distress, training of non-special health workers in the assessment and management of suicidal behavior, follow-up care for people who attempted suicide, and provision for community support, mentioned by the WHO 2019. So challenges and obstacles, stigma and taboo. Disgrace, especially encompassing mental issues and suicide, implies numerous individuals considering ending their own life or who have endeavored suicide are not looking for help and are subsequently not getting the assistance they need. The counteractive action of suicide has not been sufficiently tended to because of an absence of familiarity with suicide as a significant general medical issue and the unthinkable in numerous social orders to straightforwardly talk about it. Data quality, all inclusive, the accessibility and nature of information on suicide and suicide endeavors is poor. Just 80 member states have great quality fundamental enlistment information that can be utilized straightforwardly to evaluate suicide rates. The issue of low quality mortality information is in special to suicide. However, given the effectability of suicide and the wrongdoing of self-destructive conduct in certain nations, all things considered, under announcing and misclassification are more prominent issues for suicide than for most different reasons for death. WHO response. WHO perceives suicide as a general well-being need. The principal WHO World Suicide Report, Avoiding Suicide, a worldwide objective, distributed in 2014, expect to build the consciousness of the general well-being, importance of suicide and suicide endeavors, and to make suicide anticipation a high need on the worldwide general well-being motivation. It additionally means the urge and bolster nation to create or fortify far-reaching suicide counteractive action procedures in a multisectoral general well-being approach. So types of mental illness lead to suicide. There are many different conditions that are recognized as mental illnesses. The more common types include those listed below. So there are many types of mental illness which I have covered, like anxiety disorder. People with anxiety disorder respond to certain object or situation with fear or dread, as well as with physical sign of anxiety or panic, such as a rapid heartbeat and sweating, and so on. Then mood disorder. These disorders, also affective disorder, involve persistent feelings of sadness or periods of feeling overly happy or fluctuation from extreme happiness to extreme sadness. Psychotic disorder. Psychotic disorder involves distorted awareness and thinking. Two of the most common symptoms of psychotic disorder are hallucinations, the experience of images or sound that are not real, such as hearing voices, and delusion, which are false fixed beliefs that the ill person accepts as true, despite evidence to the contrary. Schizophrenia is a very common example of psychotic disorder. Eating disorder, then impulse control and addiction disorder, personality disorder, obsessive compulsive disorder, post-traumatic stress disorder, that is PTSD, then stress response syndromes, formerly called adjustment disorder, then dissociative disorder, factitious disorder, sexual and gender disorder, somatic symptom disorder, T disorders. So these are all the disorders these are the types of mental illness and the disorder the mental patient might have. The mental health problems in USA. Psychological instabilities are common in the United States of America. About 1 of every 5 US adults live with a dysfunctional behavior, 46.6 million estimated in the year 2017. Psychological maladjustment incorporate various conditions that fluctuate in level of seriousness, going from mellow to direct to extreme. Two general classifications can be utilized to portray these conditions, like any mental illness and serious mental illness. Any mental illness we call as like AMI, and serious mental illness is SMI. Any mental illness is defined as a mental, behavior or emotional disorder. AMI can vary in impact, ranging from no impairment to mild, moderate and even severe impairment. Individuals with serious mental illness are defined below. Serious mental illness is defined mental behavior or emotional disorder resulting in serious functional impairment which substantially interferes with or limits one or more major life activities. The burden of mental illness is particularly concentrated among those who experience disability due to SMI. So So I'm just skipping. This is one of the figure prevalence of AMI in USA. This is another figure presenting like past year in the USA by person with AMI in 2017. The figure shows of SMI, that is serious mental illness, among USA adult the year 2017. Mental health services received in the past year among USA adults with serious mental illness in the year 2017. This figure is showing. This is another figure. Now chapter 3, mental health in Bangladesh, limited facilities in Bangladesh. I have concentrated over here mental health problems and mental health facilities in our country. There are around 400 million individuals on the planet experiencing neuromental scatters, and there are around 15 million individuals in Bangladesh. About 10% of the population are currently experiencing dysfunctional behavior. The huge number of individuals are in quick needs of emotional well-being treatment. Be that as it may, the offices for the psychological well-being administration is particularly restricted both at the legislature and private levels. The National Institute of Mental Health has now around 700 beds in the administration, medical clinics for mental patients, and the quantity of therapies in the nation is about 85. This is practically difficult to give emotional wellness administration to this extensive number of individuals of the nation. The cutting edge of emotional well-being treatment is in treating patients in long-stay clinic like mental emergency clinic Patna, yet treating patients in short-stay medical clinic like National Institute of Mental Health, Dhaka, and other general emergency clinics of the nation, including every single medicine school. Network psychiatry is another achievement in the movement of psychiatry around the world. The National Institute of Mental Health, Dhaka, has been preparing general doctors, well-being laborers, imams of mosques and network pioneers for more than most recent 2 decades to give psychological well-being administration at the network dimension of the nation. Till now, the institute has prepared around 5,000 well-being specialists, 4,000 general doctors, 50 common specialists, and 200 imams of mosques on mental health. The institute are now currently giving emotional wellness administration to community individuals at the country. The institute has prepared programs on an ongoing procedure with the point of covering practically all well-being laborers, doctors, and imams working at Thana level. Along these lines, Bangladesh has been attempting its best to create psychological well-being in the nation, keeping concordance with different parts of the world. Binding and vaulting of mental patients are backdated ideas degrading human rights of the general population as a rule and creating no advantage in regard of present-day restorative administration. In the ongoing time, Bangladesh has seen presentation of parcel of psychotropic medication in the market, and these medications are making a gigantic commitment in the treatment of mental patients, including treatment of fierce patients. World Health Organization WHO, as one of its teammates, and government of Bangladesh are additionally playing their parts in the advancement of emotional wellness with the aggregate endeavors of experts, media, NGOs, pharmaceuticals organization, United Nations organizations, and legislature of the nation. Psychological wellness in Bangladesh will achieve its ideal objective in the coming time, and this is the general population desire. 3.2 Mental disorder in Bangladesh. A systematic review. Mental disorder constitute a major public health problem globally, with higher burden in low and middle income countries. In Bangladesh, systematically collected data on mental disorder are scarce, and this leaves the extent of the problem not so well defined. It is a systematic reviewed the literature on mental health disorder in Bangladesh to summarize the available data and identify evidence gaps. The research paper based on the relevant literature on mental disorder within Bangladesh published between 1975 and October 2013 were subject to a systematic and comprehensive search. Relevant and irrelevant information from the selected article was extracted and presented in table. The research identified 32 articles which met our predefined eligibility criteria. The reported prevalence of mental disorder varied from 6.5 to 31% among adults and from 13.4 to 22.9% among children. Some awareness regarding mental health disorder exists at community level. There is a negative attitude towards treatment of those affected, and treatment is not a priority in healthcare delivery. Mental health services are concentrated and tertiary care hospitals in big cities and absent in primary care. The burden of mental disorder is high in Bangladesh, yet a largely unrecognized and under-researched area. To improve the mental health service in Bangladesh, further well-designed epidemiological and clinical research are needed. The frequency of mental disorder among adults. So below table 1 present 8 cross-sectional study that reported the frequency of mental disorder in adult population with sample size ranges from 327 to 13,080 participants. The most regularly utilized screening and adhesive apparatus in this investigation were self-reporting questionnaire SRQ, general health questionnaire GHQ, and structured clinic interview for diagnostic and statistical manual of mental disorder (ACID). Be that as it may, 3 articles distributed in nearby diaries did not illuminate sort of devices utilized. The soonest fundamental examination led in urban setting in 1975 detailed 31% of outpatients had unadulterated psychogenic condition. Later, a general practice GP urban setting uncovered 29% of the patients were enduring the equivalent. A people group-based provincial examination announced 3.6% mental scatters and 2.9% both mental and physical disarranges, with gloom and nervousness being the most widely recognized condition. So table 1 below summarizes of the studies reported frequency of mental disorder in an adult, and these are the from BMC Psychiatry 2014. I'm going now predominance of mental issues and kids. So table 2 below demonstrate the outline of articles announcing commonness of mental issues in kids. Text sizes of the examination fluctuated from 210 to 3,564. Most punctual report among urban elementary younger students uncovered 13% had some sort of contact issue, with young men being twice more influenced than young ladies, 20% versus 10%. Be that as it may, an examination among socially impeded youngster revealed 23% had some type of mental issue, with somewhat lower commonness in young men than young ladies, 20% in young men and 26% in young ladies. Mullick and Goodman utilized development and well-being assessment (GAWBA). Paul and recently approved strengths and difficulties questionnaire STQ apparatus in their examination and discovered by and large pervasiveness of 15.2% in various settings, rustic, urban and urban ghetto, with the most outstanding predominance in the urban ghetto, 19.5%. Another examination around found 14.6% youngsters with social issues are revealed by the guardians in rustic Bangladesh. Another later network-based investigation announced predominance of mental issue among 18% of the youngsters. So below table 2 showing the summary of the studies reported prevalence of mental disorders in children. These are again from BMC Psychiatry 2014. This table also reported depression as comorbid condition. Okay, now I would like to concentrate on depression and comorbidity. So depression is a typical comorbid condition with chronic diseases. So table 3 displays the synopsis of the 7 articles revealed sorrow as comorbidity. 5 of the studies were medical clinic based and the other 2 were community based. 6 of the examinations utilized cross-sectional and 1 utilized case control study plan. A urban hospital-based investigation announced that among 47% patients with stroke and 54% of diseased patients had depressive episode. Another emergency clinic-based investigation found 57% of malignant growth patients with real burdensome issue. An urban office put together examination with respect to outpatient reported 16% with absolute same mental sickness and about 3% of the total or 18% of simply mental issues have major depressive issues. A case control ponder in rural population presumed that recently analyzed diabetic patients were multiple times bound to have depressive symptoms than those without diabetes, and females were more defenseless than guys. Another recent study discovered burdensome indications among 34% of diabetes outpatient. One examination, which was a piece of a bigger longitudinal epidemiological examination on diabetes in rural Bangladesh, discovered 15% of the participants with sorrow. A urban office-based study reported nearness of discouragement in each 3 diabetes patients. Pervasiveness changed from 6.5% to 31% among adults and from 13 to 23% among youngsters, regardless of wide ranges in commonness. Appraisal announced these figures strongly recommend that psychological issues establish a big public medical issues in Bangladesh. I would like to now focus on suicide rates in Bangladesh. So one of the top newspaper publisher, that is Dhaka Tribune, which is one of the online based newspaper, they reported that suicide rates on 20th January 2019, and it is mentioned that psychology says around 11,000 people kill themselves every year. So it is very alarming rate in Bangladesh, that is in every year 11,000 people are dying, they are committing suicide. So the new generation in Bangladesh are highly likely to have an increased chance of committing suicide. The new generation basically are committing suicide. It is as well found out on average 172 people in each district are committing suicide. So basically 172 people in each district in Bangladesh are committing suicide. In Satkhira there were 367 are natural deaths. On this account, to protect new generation from suicide tendency, several proposals have been made to the government to look over the issues, protecting children from drug abuse, facilitating their mental growth, not putting excessive pressure with publication, counseling and news report on suicide prevention. So this is basically the alarming rate. In 2013 it has been seen 10,000 and in 2017 it's totally a huge increase, 11,000. Almost around 11,000. Now chapter 4, result of case studies, interview guide. I have done some case studies, real life case studies with some patients. I focused over here. Interview guide. Then case study 1, respondent 1. The person was age 19. He was male. Then I have asked the person some questions and he given me some answers. So this is basically case study 1. The case study 2 is as well a male and the person age was 21. I as well asked the same questions to that person and he has well given me some answers. Case study 3 was a female and age was 34.
Could you go through the questions, please?
Sure. Question 1, could you state in your own words what is mental health? The female, the respondent 3 said, no, I do not understand what a mental health is. Do you think it is an important problem in current society? The respondent wouldn't answer. Have you ever been concerned about your own mental health? The respondent replied, she was very depressed after she got married, and most of the time she used to take sleeping pills. So do you know that at least a third of people suffer from depression sometimes in their life? Have you ever been depressed? Yes, she was very depressed after she got married. If you are depressed, how do you get better? Never wanted to get better due to bad behavior of her husband and her family. Have you ever heard of someone committing suicide? No, never heard of someone committing suicide. Have any of your family or close friends ever talked about it? None talked about it. Do you think or feel family members should consider mental health a serious issue? Yes, she thinks family members should consider mental health a serious issue. What actually makes a person committing suicide? She could not answer. Sometimes people feel that life is not worth living. Could you tell me how you feel about your own life? She felt very lonely most of the times. Her spouse, family members' bad behavior was not tolerable at all. Do your thoughts comment on you to act upon it? Not at all, or do not know. Have you spoken with someone thinking about taking their life or planning to do this? Yes, she did speak with her spouse, family members, but did not get any positive reply. On reverse, they shouted at her as well, beaten her. Have you attempted to take your life? Yes, and she got hospitalized too. So what might help you from acting on them? Being busy with work or study. Have you told anyone that you were thinking about taking your life or planning to do this? No. What is your thoughts just before harming you? Maybe from random depression. Have you prepared any note before harming yourself? No. How did you think about your life now? Have things changed for you? Do you see your life in the same way or different way? Can I answer? Have you ever thought of others before the attempt? What do you think their response will be on your self-harm or suicide? No, never. So she never thought. Did you receive treatment after your attempt? Did you get medical and or psychiatric emergency help? Were you assessed in an emergency department? Were you cared for in an inpatient or outpatient department? Yes, she did receive treatment after the attempt with some medication. She is good now. Have you ever tried to distract your thoughts by an activity or positive thoughts? Yes, like watching TV, crochet, sewing, etc. How do you feel about your own future life? Own future? Not concerned at all. What do you think about your life now? Couldn't answer. So case study 4, respondent 4. I asked the same question, but the answer is different. So these are the questions. So chapter 5, I would like to consider on chapter 5. That is basically the discussion, overview of mental health issues. As shown in the literature review conducted for the MPH, this is overall pervasiveness fluctuated from 6.5 to 31% among grown-ups, varied from 1% to 23% among kids. In spite of wide advance in pervasiveness, appraisal revealed these figures unequivocally recommend that psychological issues comprise a major general medical issues in Bangladesh. In general, the most common appraisal of mental disorder are inclined to underestimate the occurrence as a greater part of patients. What's more, their families deny because of solid shame connected to mental issues. This confines the quantity of influenced patients looking for human services dynamic. The prevalence reported by might have underestimated the rates due to focusing on the major types of psychiatric disorder. There is wide variation between rural communities and also between rural and urban settings. The commonness in an urban staff network was a lot higher, as the investigation includes more established individuals who are increasingly inclined to mental clutters. The audit proposes both country and urban settings a higher witness of mental disorder among females. When contrasted with guys, there is a fundamentally higher commonness of mental issues among financial poor respondents and explicitity among ladies from huge families, as revealed by these discoveries are steady with another provincial investigation which detailed that social disgrace hinder ladies from looking for restorative treatment for their psychological issues. Despite considerable variation in the design of studies, prevalence of psychiatric disorder in adult populations more or less similar to socio-culturally similar settings in neighboring India and Pakistan. The only nation survey conducted between 2003 and 2005 illustrated the high burden of mental disorder in Bangladesh. The general predominance of mental issues in a network study of Newdick and Goodman didn't vary much with the discoveries of the study by, as there are just a bunch of youngsters, psychological wellness experts with specific preparing in Bangladesh. The tremendous hole between genuine need and benefit capable administrations require exceptional and prompt consideration. Research in socially burdened and underprivileged gatherings is additionally expected to improve the analysis, treatment, and result in those powerless gatherings. Youth mental issues were fundamentally related with lack of help, sustained rustic home, low training of dad, and positive family ancestry, which all need a multi-sectorial way to deal with a location. This mid-June, the youngster psychological wellness study result gave a pattern measure and assess which can be a reason for taking activities for further commonness study, just as making arrangement for compelling health convenience models. Current epidemiological proof propose at any rate 1/3 of individuals with diabetes are experiencing burdensome clutters, despite the fact that the survey found 4 articles which announce also high prevalence of misery among diabetes. It is accounted for that the greater part of malignancy patient experience the ill effects of wretchedness, which is possible given the seriousness. Furthermore, dynamic nature of the malady, significant expense and need of sufficient consideration of offices accessible, restricted information from South Asian setting detail 2 to 5-fold increment in the predominant space of room in individual with diabetes contrasted with individual without diabetes. So I would like to skip this. I would like to go direct to discussion of the cases. One of the most striking results of the interviews with the cases was the response in case study 1, who was a person who had attempted suicide and was meant to have received counseling and treatment. They said that they are not aware what mental health is. Even in the most dramatic cases where someone has attempted suicide, it appears there has been insufficient discussion of what is mental health. From the case study 2, the respondent was depressed for a long time, and this led to a major mental problem. The respondent passed most of the time being alone. It has been found that the respondent felt good while was busy with the study or work, and the respondent will be in better mental health status if the person is involved in any sort of work. Family members are as well concerned about the respondent. From the case study 3, the respondent had a bad married life. After she got married, her spouse family started to torture her mentally and physically, which led to serious depression. She made an attempt to commit suicide and recovered. The respondent will lead a happy life if she away from all torment from the spouse family and being busy with the work study. From the case study 4, the respondent fell off from the stairs while she was pregnant and her backbone was hurt badly, which led into the serious depression. As she was in serious pain, she even thought sometime to make an attempt of suicide, but recovered and she got support from the family members. Her little one takes away her depression. So chapter 6 is conclusion and recommendation. Conclusion: the literature survey demonstrated that research on mental issues are not at good level in Bangladesh. Given the magnitude of the issue, the case studies conducted reveal psychological well-being among the several youth that were the focus of these case studies that had attempted suicide still needs to be nurtured in order to reduce the risks of any further attempts. It has been found out that from the survey that the major cause which leads a person to attempt suicide is depression, which at certain time convert to serious depression. Support from the family members, friends, which matters most, as well being involved in any sort of work or study. Many awareness program or campaign on depression mental health should be conducted in Bangladesh by NGOs or government organizations on a huge scale to reduce the alarming rate of suicide in Bangladesh. People should not be afraid or shy to visit any psychologist. Like physical health, mental health should be considered as common symptoms and should be treated in the right way. Recommendation. There needs to be implementation of the recommendation of existing literature and reports conducted by the government and NGOs in Bangladesh in order to reduce the suicide rate. Some of the recommendations to the Bangladesh government are: government should publicly identify suicide as public health issues, dedicated government unit to study and monitor suicide trends, set up suicide hotlines, address mental illness more vigorously. School and health care workers trained to identify signs and help cope, provide follow-up care to those who attempted to commit suicide. Further data needs to be gathered. Further well-structured epidemiological and clinical research are required. State-funded training and mindfulness techniques to enhance psychological well-being conditions may be attempted to improve the situation, and I will conduct the interview in further during my part of the PhD. So these are the Appendix 1 consent form and the Appendix 2 informed consent form. Then Chapter 7 acknowledgement and Chapter 8 references. So that's all. Thank you very much. Thank you, Professor Trina, for guiding me.
Thank you. Yes, it's most interesting. Thank you, Trina, for your presentation and for the work on the thesis. So now we have a few professors with you, and we're going to ask you questions about the thesis, and we may give you some suggestions on how to finalize the thesis after revisions. Who would like to start?
Yes.
And could you please introduce yourself?
Yes, I'm Hassan Erbay. I'm a bioethicist and a medical doctor at university in Turkey. Thank you very much for a nice presentation. It's well structured thesis. I would like to say a few words, but I also make some remarks on the paper on text. But maybe it's again, but it will be better. You use DSM 4 or 5, which is up to date. And it will make your thesis more popular and more up to date. And maybe one more thing. Conclusion is now a bit short. Also, it is better to make more conclusion in the section. Yeah.
Thank you.
Recommendations is good and enough. Thank you very much.
Thank you very much for your valuable comment. I will work on it definitely.
Okay, thank you.
Okay, I'm Nader Gotbi from Ritsumeikan Asia Pacific University in Japan, and thank you for reading a lot of your dissertation for us. I have given you other comments, but now my focus now is on your conclusion. So remember, the conclusion usually should include a reference to your research question and what happened to its answer? How did you answer the research question you asked, and then the research objectives that you had, and what was the result of those, studies that, you had objectives. So did you reach the objectives? And now especially the first line, you see, the first line you say, the literature survey demonstrated that research on mental issues are not at a good level in Bangladesh given the magnitude of the issue. Like whenever students talk about scarcity of material on a topic, I become very curious and I do a little search and to make sure they have done a good literature review. So I just did it now, and I found some papers. I'm going to ask you if you have read them. For example, this one, Prevalence, Pattern and Determinants of Mental Disorders in Rural Bangladesh.
Yeah, I have read it.
Okay. And okay, the first one. Mental health, quality of life, and nutritional status of adolescents in Dhaka, Bangladesh. Comparison between an urban slum and a non-slum area.
Yeah.
You have read them.
Yeah,
So,
I have read them.
like, it seems there is quite a good number of papers. I mean,
Yeah. There are quite a good number of papers, and as well those papers I have added some contents as well in the thesis.
okay. Mental disorders in Bangladesh, a systematic review.
This is also here.
Okay. So I think, I mean, if you have read these papers and if you have referred to them, there should be a good amount of information. Your title talks about the issue of probably lack of awareness about mental health. So that could be a better thing to include, like the literature survey, for example, showed that the awareness about mental health is not at a good level, the knowledge of, So still you can stick to what was your main research question and what research objectives you had and what was the result
I will
of it.
write more.
Yeah.
Like
Very often the research objectives, like one or two of them, return to what you found during your literature review. One of them could be related to the result of your personal interviews with, and one last one could be the recommendations about if you included, I'm going to make recommendations, what can be done, and then you have some recommendations, so that could be your last research objective.
Okay.
So yeah, if you can rewrite the conclusion part, I think that would be very helpful. That's my only comment.
And the title has changed, I think.
Yes, the title was developed based on the earlier comments.
And is it still prevention of suicide? Did you say something about prevention of suicide? Yeah. Okay.
Written.
Okay.
Like raise awareness.
Because there are two different things.
Yes.
Prevention is something different, and the
Awareness is
yes,
different.
awareness is different.
Different.
So
Both are mentioned.
Yes, you should better mention
Both.
awarenesses and prevention. Yes, good.
So in addition to those comments, I think I found in the result, it was quite surprising in the cases that you mentioned. These are people who had committed attempted suicide
Yeah, and recovered.
and recovered, but they said they're not aware of what mental health is. So why do you think they answered they don't know what mental health is? Is it a denial of their own suicide attempt? Or is it they really don't know what mental health is?
Two of them, they really do not know what the mental health is. Like they do not consider, they do not think in that way. Like mental health is as well important, like physical health. Like they do not consider that this is very important. Like if we have any problem in physically, we go to a doctor. But if we have problems in mentally, we usually do not visit psychiatrists often. So that is the reason two of them mention they do not know what is mental health is. Thank you.
So, would you guys like, Janice, that you would like to make some comments?
Yes.
Now, for the videoing, I'm conscious, because I don't want the photograph of the room going on the internet.
No, I
Okay.
never use social
Yeah,
media, you know
yeah,
very
yeah.
well. I don't use any social
But I'm also for the video, but I'd like to take a video of you talking. Do you think you can move over a little bit? So the
Well, my
curtain's
corner
behind
is
you.
more safe.
Sorry?
This seat is safe to talk.
Oh, but it's also, you want to make any comments?
You may.
We can move over.
Yes,
You come
okay.
too? Can we move this over so the seats are closer together?
It's a sofa.
And then... Okay, when you're making your comments, sit in the comments, Jeff. Okay, how's that?
Yeah, like a common chair.
A comment chair.
Yeah.
There's a hot chair. You're under examination
What's
at...
your name?
Trina.
Trina. Oh, okay, you're Trina.
Yeah,
Good
Trina.
morning, I've been hearing your name.
Okay, so I'm going to focus on you two first and then Anke can comment later.
Thank you very much, Trina. I'm Dr. Shanaz Chaudhary, Associate Professor and Head of Community Medicine Department, and I'm working at Bangladesh University of Health Sciences. That was an excellent presentation because the title is very much burning in Bangladesh now. But I think the title, could you please go to the title? Yeah. What I was thinking of, like giving you a suggestion, like the title could be like a pilot study on ways to increase people's awareness of mental health and prevention of suicide in Bangladesh, not to use to prevent suicide. That's the thing,
Yeah.
isn't it? So
Yes.
prevention of suicide in Bangladesh. So that was my observation up to now. Like, could you please go through some of the results?
Or you, maybe just the comments.
Yeah. So, like in your conclusion, you stated that case is a case study. So, like, how did you come up with this case?
I have interviewed some people who have attempted suicide,
Okay.
and I have asked some questions. I have done some research before asking them questions,
Okay.
and some questions which is very important. I have done some research before. I have asked some questions. I have done some real life case studies. I have interviewed 4 people who have attempted suicide, and before asking them questions, I have done some research, like what type of questions I should ask them, and they have replied me. And based on those questions, I have assumptions on conclusions and as well on the case studies report. So that was my assumption.
I'd like to give you a suggestion. Just recently, I think it's not even 2 weeks back, there is a big research dissemination program regarding this mental health. You know, it is done in Bangabandhu Sheikh Mujib Medical University.
Okay.
So there are lots of findings. So I think you can add, even though you have presented, I think in the literature review you can add those information, just like those 2 professors say, you know. So I think that will be wonderful because this is very much recent data about Bangladesh study regarding mental health. You know? So that
Sure.
will be wonderful. Okay.
Thank you so
very
much for your valuable comment. I have heard many comment on my title. One is like people awareness of mental health to prevent suicide in Bangladesh. Another is mental health awareness and suicide prevention in Bangladesh. So these are the 2 comments I have received, and I will work on it.
Yes, I
It
think
will
we'll work
sound
on-
better according to my thesis.
Good.
Thank you very much for your presentation. My name is visiting professor of EUCN in traditional medicine systems, and I would like to make a comment on the possible risks of doing this kind of research. One is on the participant side, on the research subject. The person you interview, when you're doing the interview process, he or she could get a flashback, meaning that memory could spring back, and the post-traumatic stress is again repeated onto the person. So there is a risk from the research subject side. Secondly, it's also the risk from the scientist side, also from you. Now imagine your father died of suicide. Your father, your real father. Now you were small, maybe 7, 8 in the second year school, and it was very bad. So, but you have, over the years, it's somehow you worked on it and it's fine, your life goes on well. But then you could get a sparking flashback. Right. Yourself as a scientist, it can fire back on you, and then you are the one who need to go to the psychologists. So meaning, when you plan such a research, it is very important that the scientist is aware of what can happen. Yeah. Especially in this kind of high risk. It's also when you do refugee study. When you study refugees, you have similar, often have very bad either war trauma or trauma on the way they come to. Right. And so it's very important in the research to consider this. And usually what happens that you at least have a number of a psychiatrist who is on standby, who are you comfortable with, who you know, so that in case anything happens during your study, you quickly can call. Like, better now is if that person is with you, but that is only when it's possible. When not possible, a hotline, so that the person is on standby and aware that this time to this time you do these interviews. Right. And also after the interview, sometime, like up to 6 months, you should have access to this kind of person, so that you immediately can. And in the research ethic proposals, usually that is also written. You have to declare how to. Though I could not see your research research ethics proposal, and therefore I could not see, but this is very important.
Angelica, do you have some comment?
Yes. Thank you very much for your very good presentation. I'm Dr. Angelica Bainon, one of the visiting professor of AUSN and also member of the governing board. First, my comment is on the title, so to further reduce it. And another suggestion, please write, could be mental health awareness and suicide prevention in Bangladesh. Another thing is probably it just for improvement, you can come up with a framework of your study, like in just one map, that be able to put all the like a model, for example, of how you were able to address this study of yours, so that the reader, once they see it, would visualize on how it was done and what are the suggested ways and means for the Bangladesh people to be aware of mental health, and also to add in the prevention of suicide in Bangladesh.
Thank you.
And Shans, you have some comment? Yeah.
Hello, thank you very much, Trina, for your wonderful presentation. I'm Dr. Shahnaz Chaudhary. I'm the Associate Professor and Head of Department of Community Medicine working at Bangladesh University of Health Sciences. It's a wonderful thing that you have worked on these mental health issues, because it's a very important issue now in Bangladesh. Yeah, like Angelica ma'am said, like the title, according to her, I agree that it should be mental health awareness and prevention of suicide prevention in Bangladesh. That could be a very good catchy title. And another thing I would suggest that recently, I think 2-3 weeks back, there has been a study dissemination regarding nationwide study on mental health dissemination. So lots of information, updated information has been disseminated. So you could use those data to enrich your thesis. That's all. Thank you so much again.
Thank you.
So in conclusion, do you have any other comments? I think you've got, basically everyone has approved the thesis, so congratulations to you.
Thank you.
And we'd like a few revisions in the content to bring out some of the points that were raised. Do you have any?
Thanks to all the professors and their valuable comments. Definitely I will work on it. And just very beautiful titles, suggestions has given to me, and I will as well match with the thesis and change the title as well. And it's very important that this mental health is very burning issues in Bangladesh. That is the reason I have chosen and picked up this topic. This actually catch me like to do much more research of mental health, and I'm looking forward to do much more research on mental health and as well prevention of suicide in future. Thank you.
Thank you. Congratulations.
Thank you, professors.